So what makes childhood obesity different? The short answer is a lot. And the long answer we'll go into a little bit more in detail now. But it's talked about before, obesity is like a phenotype. It's how it looks on how a disease looks on the outside, but it's driven by many different genotypes on the inside. And childhood obesity is almost, in my mind, a distinct subtype of the disease of obesity, because not only is it more aggressive, meaning, for instance, the transition from insulin resistance to frank type 2 diabetes in children is faster than it is in adults. It also has different comorbidities that are unique to childhood that the adult world doesn't actually deal with. So while most adults with obesity didn't have it as children, if you are a child with obesity and it's left untreated, even as a toddler, you have an over 80% chance of having obesity as an adult. And if you're a teenager, that number goes up to 95%. So probably the biggest myth that is untrue is that childhood weight is just baby fat that can be grown out of. That's just not accurate, and it's dangerous. And it really should just leave everyone's mindset because there's really nothing supporting that it's accurate. Now, in terms of the different diseases that can happen in childhood, which again, most people don't think of, we talked about how type 2 diabetes or insulin resistance progresses faster in childhood. Well, so does liver disease. So does metabolic dysfunction associated steatotic liver disease. That also progresses to steatohepatitis faster in children than it does in adults. So there really is no rationale for holding off or delaying care. It only hurts the patient. And then obstructive sleep apnea, which obviously is very common in adults, definitely happens in children as well. And if you think about the adolescent brain, it doesn't fully mature until around age 25. So whatever insults that might be happening to the brain while it's going through this maturation phase, are even more important, because the brain is still plastic and it's going through its pruning and its optimization of pathways. And if you have untreated sleep apnea where your brain is deprived of oxygen at night, those processes are slowed or even disrupted. And again, that doesn't happen in adults. So much more important in kids. It actually even impacts the kids' academic performance. And then that obviously impacts job attainment and job promotion and overall economic productivity. So it's a lot more than just helping kids get better. And then there are conditions like Blount's disease or slipped capitofemoral epiphysis, which are unique to children because they're growing vertically and they're open growth plates. So again, it takes a little bit more, more of an aggressive approach in children, because these issues, once your bones bow from Blount's disease due to excess weight, that doesn't reverse. That requires surgery to fix. So there is no good reason to delay care for childhood obesity, which you've obviously heard me say a few times already. So treat the obesity when it's diagnosed, not when you think it is your personal belief it should be treated. And it's going to potentially require a lifelong of treatment. So if you yourself don't know how to manage it, refer patients to places that do, if you can find them. But we'll talk about that later as well.